I had a I'm excited. I actually had a script to follow, but we have already jumped into conversation, and this conversation is good. So I am going to go off script and just go right into it and flow because this is supposed to be just a conversation. So my name is Belisa Armstead. I'm first vice president of the Grand Rapids alumni chapter of the Delta Sigma Theta Sorority Incorporated. I'm excited to be joined by a phenomenal panel that is going to be bringing a conversation around an important topic of mental health. This is, again, a conversation, so we encourage you to join in with us. I will share that although the conversation will center around women and youth, it is a conversation that is needed for everybody. So please take some notes, take your time, glean what you can, some strategies, and continue the conversation. Because one of the things we already heard today is that although we are ending the month of mental health, this is a long, ongoing journey. So with that being said, I am going to turn it over to Dr. Lisa Lowry.
Well, thank you, thank you, thank you. So thank you for all of us, for all of you who have joined us this evening and sharing your time. We hope to have a great conversation. I have some dynamic panelists who are joining me this evening for our discussion on mental health. And as we're ending the month of mental health awareness, and we hope that this is just a launching pad to continue the discussion of mental health awareness. My name is Dr. Lisa Lowry. I am Section Chief of Adolescent Medicine at Helen DeVos Children's Hospital, Corewell Health West. I am going to turn the virtual podium over to my dynamic panelists to let them do their own introductions as they so fit, and let them tell you about themselves. So I'll just go in alphabetical order, and I will start with Miss Janae.
Oh, thank you. Can you all hear me okay too?
Yeah.
Make sure. All right. So, hey, everyone. I am Janae Beville. I am a licensed professional counselor. I have been a therapist now for almost 14 years. And so I have worked in a variety of settings in home, in schools, and in an outpatient setting currently, and have been for many years. And I right now currently own and am the lead therapist for my own private practice, Beville Counseling. And so there we offer outpatient therapy virtually right now, only to clients ages 9 and up, and as well as couples, individuals, just the gamut of life and people. And so our hope is always to continue to serve people as we are addressing our mental health every day, because it affects everything and part of our lives. I know I'm getting into it, but it's hard for me not to say why I do what I do. So that is who I am and what I have been doing for many, many years. So I'm very happy to be here as the resident therapist.
Awesome. Thank you. All right. Next we have Dr. Eddie. Not
Okay, I am Lemetria Edie. It's Johnson Edie, but I use Edie. It's too long, especially my license does long. So I just go by Edie. I have studied educational leadership, research and technology for some time now. I've been an educator 28 years. I was a high school English teacher, middle school English teacher. I coached for a number of years within that 28 years. And within that 28 years, I've been an administrator 14. I'm from the community, Saginaw community, born and raised there. I went off to school at Howard University, and after a year, I'm like, I'm working really hard in this community. I want to go back home and help my own community. And I did that for some time until 10 years ago. And just faulty leadership led me to Grand Rapids. And I'm like, it's got to be something different. And so I landed in GRPS and I love it. I am currently at an elementary school performing arts, and one of my youngest daughter attended the school. I was never her principal, but attended the school. And I've been married 26 years, have 4 adult kids, And I am happy to be here. This is a very pertinent topic, and thank you for having me.
Thank you. Thank you. Awesome. And Dr. Johnson.
Hello, I'm Dr. Valisa Johnson. I'm Section Chief for Pediatric Neuropsychology at Helen DeVos Children's Hospital. I know most people have no idea what a neuropsychologist is. So the best way to describe what I do is if you think about brain imaging, everyone knows that that kind of looks at the structure of the brain. EEGs look at activity of the brain. And what I do as a neuropsychologist is I look at what all that means from day to day. So I do evaluations that assess memory, attention, problem solving, speed of thinking, and other domains of thinking skills. So I primarily work with children and young adults, all of whom have complex medical conditions like epilepsy, sickle cell, but any type of medical condition that impacts the brain or spinal cord.
Awesome. All right. Well, thank you. And so we have a vast, just a treasure trove of talent here on this panel. And so we're going to get right into it. Unfortunately, we did not tape our conversation before we got started, but we already had a lot of great conversation before this webinar got started. So we're going to get into that. And so if you don't mind, we're going to use first names here. So we're going to all right. Thank you, panelists. So I'm going to start with Janae. You started down this pathway a little bit. So let's just go back to this. I'm going to go back to you with starting with this question, but for all of you, mental health has always been an issue. However, over the past, especially 2 years, I don't want to say since coming out of the pandemic, but let's say out of the pandemic, COVID, we've seen an increase in things like anxiety, depression, and eating disorders. And I was sharing with you all that I've been doing this almost 2 decades, and I've never seen it this bad. I mean, it just got, it's, we're just kind of like swimming sometimes. But what mental health issues are you seeing in your practice, whether it be students, parents, families? And so for all of you, but we'll start with you, Jeanette.
Sure. I think to kind of jump in, because you all were starting a conversation about what is it? Is it, mental health awareness? Is it a crisis? That doesn't sound right. The word that just came to me is mental health awakening. Like, to me, it's become, not since kind of COVID did it, but really it became an awakening for people to finally, one, give thought to mental health as a part of my health. And so I don't think it's been more. I think it's being reported and talked about more. And people are being able to feel safe enough maybe to speak on it, even publicly. Even our generation now being able to talk about, I go to my therapist and this is what my therapist said. And, it's in our language every day. And I think we're just getting more people who are like, okay, maybe I do have some symptoms of, the many things. And so I think just kind of coming into that conversation as I was listening to you all, I think we're having an awakening. And so for me as a therapist, I'm doing it for, like I said, almost 14 years. What I'm saying, my practice isn't anything new in terms of like the topics. We know for sure anxiety and stress is probably at all-time high. As far as I know from old research and new research, is still probably #1 diagnoses out here, just because that, appears to be what most of us are feeling in some way, shape, or form. And so, I always say to my clients and just about anxiety that depression, anxiety are cousins. They hang out, one's around, the other one's usually hanging around too. So I really put them both together that we definitely see a lot more of those symptoms out for people. And that's, again, young children. When I did infant mental health, so I'm talking from utero to the oldest person having some sense of stress, anxiety. And then, of course, when you have so much of that going on for you, the depression symptoms can come just with the hopelessness and just being exhausted and tired and just feeling like, how do I fix this? I cannot feel better. And so they just kind of, it starts to become what causes what. We can get into the why all day, but really those are kind of the biggest things I see. But other than that, obviously our mental health affects everything. So what I'm seeing is relationship struggles, whether it's with parents and their kids or, romantic relationships, couples, relationship with ourselves is also it. So a lot of people also, honestly, I think having an awakening to who they are and asking those questions to bring self-awareness. And so we're just seeing a lot of people wondering what is going on with me finally, and asking those questions to themselves and taking the time to figure out why they do what they do. If they've experienced trauma, maybe finally seeing that it is trauma and wanting to start the process of healing. And so I see a gambit of struggles that people deal with, but those are, kind of the main ones that come to mind that we see, but we see everything because everyone's dealing with probably everything. So that's what I would say at this point.
I really like that awakening. Yeah, I do like that. How about you, Nitra?
So in my line of work, wow, parents typically, they complain, they have concerns, but it's really not about mental health. It's more so, this is driving many of my colleagues and I like just off the wall, is the bullying. They talk about bullying a lot. And so I believe it's more so the definition. And then when you ask them, what does that mean to you? Well, they're teasing, they're taunting, they're so concerned. But again, if we stop and analyze that, right, it is mental anguish if someone's teasing, if someone's taunting, but it's typically siblings who are at the school as well. It's cousins, it's a family situation. And we find, as far as teachers and administrators, social and emotional learning, we do what we call circles to help really curt a lot of that language bullying. It's bullying, and this is they're teasing and they're taunting and when you really dig deeper, it's not that. It's more so the parents are concerned with their child's mental health and the state of which it's in, because they go home complaining about it a lot. Such and such has said this and such has said that. Well, what did they say? Well, and this is the one that comes to mind. Well, I look like a butt cheek. Well, do you look like a butt cheek? No, of course not. Well, you know this, right? What do you say? What do you do? Well, I go home and tell my mom. But we say, if you see something, someone is making you feel a certain kind of way, tell the adult so we can sit and we circle up. That's a part of the mental health. That's a part of the social and emotional learning. Our families and scholars don't have the tools for their toolkit to handle it. So they yell out and scream, my child's being bullied. Well, is it really bullying, or is it teaching them how to combat the immaturity at the elementary level? During the pandemic, our babies were out of school 18 months. So who did they interact with? Each other, home, parents, or not. Or it was a electronic device in front of them, a TV in front of them. So the biggest concern we have is that coined term, my child, bullying, but it's mental health and how to, like you said, Janae, relationships. And they don't know how to interact with one another and talk and communicate and relate. That's the gap. And we see that often, if not every day, every hour of every moment. That's the biggest concern.
Lisa, what do you think? What are you seeing in your practice?
For what I see with the type of evaluations that I do, it's really twofold. So I do see a lot of anxiety and depression. A lot of the kids that I see, they're already predisposed to mental health issues just as an artifact of their medical conditions. There's some medical conditions where it increases the risk for that. But then just adjusting to treatment and things like that, it can increase anxiety and depression. But with the pandemic, a lot of the kids that I see took a significant hit with having to do virtual learning. And that really impacted them not just academically, but also socially. So when kids come into my office, it's usually because there's a problem with something, whether it's they're failing with school or they're struggling at home, they're having behaviors at home. So I see a lot of kids that feel defeated because they're falling behind and they're not able to get caught up because of that gap with having in-person schooling and virtual learning. There's some kids that I see where they really excelled with that, but majority of them, not so much. The other issue that I see with the increase of mental illness is parents becoming more aware because their kids were at home during the pandemic and they're able to see a lot more of what's going on. Like, oh, that's what that teacher was talking about. I see it now. So then they're coming and bringing their kids into us because of those concerns where maybe they sort of dismissed those issues before that the teachers were noting.
Yeah. It's very interesting. The other question I kind of had, and for whoever wants to take this, have you noticed, or I will say, I've also noticed there's been not just parents, well, kids and parents too, the ability just to the interaction, that interaction with people, that interaction, those, it's so easy when you said you said something about like it's bullying, but also the not having the tools, the communication. And I'm wondering, because of these these rectangle devices that we have, are we going to have more and more less ability to self-solve? Though the technology is great, but the communication, we can't, they don't know how to communicate with each
I'll
other.
take that. I'll jump in because I failed to mention that for 17 years, I was in secondary education. And now for the last 3 years, I've been in elementary education. And being at the secondary level, you see where the kids missed the mark when it comes to behavior or academics. And there are some gaps, areas of growth needed. But at the elementary, we limit based on so I pulled a lot of data. I started looking at behavior data, attendance data, and to what Dr. Valisa said, yes, it was because parents were home more. It was because they were with them more and they saw. So it was a heightened like observation, but we limit, looking at all of this data, we limit the time spent on technology. Yes, our scholars test a lot when it comes to, baseline data, then you have mid-year, then toward the end of the year. Yes, but when it comes to monitoring, checking for understanding, we limit that. We have programs and I do classroom walkthroughs, making sure I am observing how much time. And I had to address with one of the teachers, this is not what the expectation is when it comes to the devices. Kids are not in small group. There should be a limited amount of time because I'm operating with preschool to 5th grade. The oldest child may be 11. Okay, so we limit the amount of technology usage. We make sure parents understand it. Can they come home with? No, they cannot go home with their device unless they're ill or unless they have a medical reason. So because of these, as you call it, rectangular devices, I noticed it 3 years ago. And so we did an implementation plan on technology usage. We also, because we're performing arts, they don't have a lot of time because we have 5 specials that they go to every single day, every week. So absolutely, the technology is an issue. And I've been confiscating cell phones as well because it's easy to hide. They are easy to hide.
Well, so kind of, I'm going to stick with you, since as a school administrator, what keeps you up at night?
Wow. This year, if I would say I've been up, it's been about parents not understanding that the way they did school 5 years ago, 10 years ago, 15 to 30 years ago is different. It is not the same. So their anxieties oftentimes spill over into their children or their child of what they went through. Because every time they sit down in my faux leather chair, they say, well, when I was in school, it happened to me. Well, it probably didn't happen the same way because you didn't have a one-on-one device at your fingertips 15 years ago or 20 years ago. Okay. So them not understanding the work that we do during this era and the resources that we offer that they decline and deny because they're just not educated or well versed about them. And it stresses many of us because we've been advocating and we've been proposing and we're finally getting the money from, and you hear a lot of times the ESSER dollars, we're getting the money and the funding, and the parents are saying, no, wait a minute. And we have information sessions, we have parent meetings, small group, whole group, and we're trying to inform them and we work to inform them, and they're just pushing back because, again, it's not discussed enough and they're not understanding really what a mental health concern looks like or what it is, or I'm not crazy, or I don't want nobody in my business, or if my child says something and I'm not around, CPS coming to take my kids. No, ma'am, no, sir. So that keeps us up. I'm in this with all of the other educators across the country, but that's a major concern.
Janae, I saw you nodding your head a lot. No, so comments, follow up.
Yes. Excuse me. Of course, Babita talks. I'm always smiling because of how she says things. I just love it. But also in agreement with her too, about what keeps me up, if that's the question, or just following up with that too, as a therapist and doing it for a while, and now owning a practice, so really having a lot more hand in when people are finally reaching out for help and what they're asking for help for, and then the barriers to getting that help. That is probably the biggest bothersome thing for me as we are dealing with this growing mental health awakening is we have moved a little bit further and people reaching out for help and support, and there are resources. However, we are still very much an insurance-based healthcare system. And even though people have it, I'm speaking as a provider, what frustrates me is I want to help people and there are still barriers to that. Whether it is, they still have to pay even though they have insurance. That is a surprise to people. So we do a lot of education from the beginning when people even call to get help and say, well, I have insurance, I should be able to get help. Yes, but know your benefits because you may still end up with a bill. And that will literally, people have had to stop therapy because they couldn't afford it. Mm-hmm. So that really bothers me. And even though I'm a business owner, one of my thoughts is, how do I make it so anyone calls, whether they don't or do have insurance or have high deductibles, whatever, that's not a reason that they can't have therapy. Mm-hmm. That bothers me. And second, just having enough of us, and I mean therapists and people who treat them, especially those of us of color, honestly, therapists of color. So I forgot to mention that in my practice right now, we have all therapists of color. And that didn't happen on purpose, but I believe God led it that way. Because more of us in our communities, the brown and black, are reaching out for support. And so one of the things that also gets to me is making sure we have enough good therapists to treat our people, because we know it's been great that a lot more people are like, I want to go into, mental health and social work and be a therapist, and a lot we have, it's more. But we got to make sure they're trained and ready for it. So those are the things that keep me up, is how do we make sure we are meeting the need as it does increase. And knowing that we have, people have things at their fingertips in terms of, kind of over or self-diagnosing themselves. And so having enough even resources for them so they can go get tested and not just, I think I have ADHD, but do nothing about getting any treatment for ADHD. so many people say they are ASD, but no one's done any testing. And if they do, it takes months to get tested. So, just the barriers of how we can even get treatment are kind of things that get to me. And I thought, yeah, okay, I'm done.
No, you have plenty of time. And just because you haven't and think you have anxiety, can your doctor write you a letter for a therapy dog? I'm sorry. I'm sorry. I'm sorry. And I'm like, just getting a therapy dog does not mean and saying you have anxiety. No, I cannot write you a letter. Okay. That was my own little vent. But I mean, and that's the thing. They like, oh, well, I have a dog and it soothes my nerves, and then I have anxiety. Can you write me a letter? No. Okay. I'm glad you have a dog, and maybe that does help your anxiety, but maybe take another step. But with that on the rise, you talked a little bit about that. So, and it is important. And I think one of the good or bad things that came out of COVID is like some of the employee assistance programs. And so I've told people, and I've told them, I said, well, go to your employee assistance programs. Well, I don't want people in my business. I said, the employee assistance programs, A, tend to be free, and B, they're not in your business because they're totally different. So I've told a lot of people that work for every, all these companies from Corwell to you name it, they said, well, I said, but you can maybe get 6 or 7 sessions. And it's a good way at least to try on therapy. But yes, it's not always free. But what other things, what other mental health concerns are you seeing? Anything particular in women that you're seeing, or anything concerning in youth that you're seeing? I know you talked a little bit about, but anything in particular that you're seeing or that you want to talk about that you're seeing in your practice that you haven't spoken about already?
Speaking to me?
Yes. Yeah. Sorry, Janae. I'm sorry. I'm sorry. I got on that rant about the therapy dog, and so I'm probably Jeanette. Yes, I'm talking to you. Sorry, I need to focus. And you talked about ADHD. That's the other thing. The therapy dog that'll help my ADHD. Can you write me a letter? I'm sorry, but yes, I'm talking.
No. Yeah. So for us, speaking to those who identify as a woman, some of the things that we are seeing, I kind of split it up in 3 parts. So one, as a parent, as a mother, the struggle with having to manage it all, literally it all, whether they are in a couple, married, or they're single parents, doesn't matter. It's the management of work, it's the management of the household, it's the management of the kids and the extended family. So being caregivers or taken care of, or their siblings, even I'm talking adults in their lives that they also have responsibility for. So that part is what we're seeing for a lot of women to sort out and try to cope with and deal with. And then in terms of with their partner, so being a partner to someone, the conflict in those relationships, feeling unsupported, feeling disrespected, in all honesty, abuse. Those are the things that a lot of women that we serve are dealing with. And I'm talking even from when they were children on up, unhealed, undealt with, unnamed abuse that many have gone through. And then honestly, the third piece I would say is just as people, just being a human being that happens to be female, identity, and the social pressures that come with that, that you're supposed to be at a certain point in your life, and whether that's, to be married and to have kids, or to be a certain way as a female, which kind of gets into your self-esteem and your confidence. And again, if you've had any type of abuse, especially sexually, it hits on all of that. So for women, it's everything. And because we are wonderful and leaders of our world and families, how we are really affects every relationship and everything we do, and in the work we do, and how we show up in this world. And so it's just really, for us, doing the work with women, is giving them a space to put it all on the table and not have to put on the strong face, being able to say how they really feel, about their kids. You even say, I don't like my kids sometimes. Yes, you can say that here. Being able to say, I know I was married for 20 years, but I never really liked them. And I don't know how, I'm waiting for one of us to die or something to happen. Like literally the things that women have been carrying for years, giving them a safe space to unload all of that and to unpack and to cry and to be angry and to know what to do with that anger in a very productive way, instead of just the many ways that we see us doing. So yes, with caring for women, it is encompassing this whole individual who holds a lot and being able to hold them, and even for that moment that we have them. So that's what I'm saying with women.
That's very important, you know, because what is it called? Sometimes you're in that sandwich where you're taking care of your kids or your older kids, and then you're taking care of your adult family members, and it can be a lot, you know. And we're not superheroes, you know. And being able to step back and having that space to say, hey, I'm not okay, you know. Yeah. How about youth in particular? Anything with youth? You like anything concerning that you're seeing additionally with youth? I think you said you see 9 and up, but any particular things that in the spaces that you're working in as well?
Oh, definitely. For our young people, still just honestly managing those emotions. So we kind of hit on it talking about, communication and learning how to problem solve and again, even self-esteem, but really the management of how to deal with life because life is life and for everybody, including our children. And so we often, see behaviors that can be very frustrating for adults. And we're just trying to fix the behavior so life can be a little bit easier for us. However, we know our children, especially that preteen and teenage years, suicide is number 2, number 3, the leading cause of death. So they are not knowing how to manage all the things, whether you call it bullying, whether you call it self-esteem, whether you call it whatever, it's I'm feeling things, I don't know what to do about it. And so it's easier to not be here. And that's really the struggle when we come down to it. So just seeing our young people struggling and suffering and being able to hear them and not just go, well, they just being hard-headed or they just be on their phone. If they get off their phone, then maybe they would, like we get very, I think, parental in our responses to when they are displaying mental health concerns and needs. Or in all honesty, kind of come see us and we somehow have to fix them when it's not a them problem, it's a family unit problem. So, or even medication, which that's a whole conversation, but it's let's fix it quickly. And again, our mental health is with us every single day. It affects every part of our lives. So I say to the young people that I work with and the therapists who work with young people, like, if they can learn skills at the age that they are, that carries them into adulthood. And hopefully that gives us a better, healthier community, healthier parents in the future, healthier partners in the future. So get them started now, even if they sit in a session, they don't want to talk, because a lot of them don't. They know that you force them to be there. And I say to my therapist, as hard as it is for us to sit there, please know, we don't like it sometimes either to be sitting there and having to pull teeth and all of that. But we know that when a time comes and they have an issue, they have this person that they've developed a relationship with that they can talk to. So don't wait till there's a problem and then do it. Just, I say everybody be therapy, even if you think you're doing wonderful in life, just get your therapist and have them on standby if you got to meet with them once a month or every 3 months, whatever it is. But if you can get our young people started in talking about and treating their mental health concerns, not just be aware of it, let's treat it. We can start early with them learning skills to help manage life, because we know it's gonna get tougher as we get older.
Yeah. And my parents always go, well, they don't like to go to therapy. I said, well, no one likes to go to therapy. And the kid sits there and looks at me and like, she gets it. And I'm like, well, you go to therapy, I make you go, and then I sit there and make you talk. And I tell them, and I tell parents, I said, that frontal lobe is not completely formed. So where therapy works, it doesn't work. It takes a while. And parents go, oh, the other one thing is they go, well, they don't want to come home and talk to me. I said, Mom, Dad, they've been on stage for 10 hours. And they go, what? I said, they have been on stage for 10 hours performing. When they come home, they need to come off stage. So they don't want to come home and talk to you. You don't want to come home and talk to you. And I said, they don't want to talk. I said, you didn't come home and talk to and tell your mama everything. Don't sit there and tell me that. And they go, oh. I said, you didn't. So don't wait, and they go, well, I didn't. No, you didn't. When you were 16, if I went back 30 years, you did not come home and tell your mama everything, so don't tell them. No, let the kid come home and rest. Let the brain rest. Give them step back. And then give them, you don't want to come home. How was your day? Don't nobody want to do that. And give them some space. And then they go, oh, and then some of the parents, I'll be like, I don't want to come home. I don't want to talk to you for the 15 minutes. No, I'm just joking. Don't tell a parent. Don't tell my parents that. I love my parents. All right. Miss Felicia, I'm going to talk to you. You're a neuropsychologist. Usually I'm coming to you. I know you have a passion and advocacy for families. I know a lot of times families are coming to you when they're sick or they're trying to figure out a diagnosis. And one of the things we've talked about when we met is and have spoken, you've said, what suggestions do you have for parents of young people regarding like mental health or screening or testing, and especially for for what you do or for our community? I know you've heard about like mental health, there's the stigma, the testing, there's a lot of stuff. I don't want to get my kid labeled, but what recommendations, what would you recommend for our community or for our people in our community? What suggestions or your thoughts? What should we be doing?
Yeah, I think in terms of the stigma that we have with mental health, it seems like there's been a lot of improvement in that area. The biggest concern that I have and the biggest suggestion that I would give to parents is to trust their intuition, because about 80% or more of the time, the testing that I'm doing is just confirming a parent's intuition. And so when parents go to their pediatrician and they express concerns and it's kind of dismissed, it's important that they still push for those referrals and push for those formal evaluations. We know that it's still an issue with the disparities in our community, with us being underdiagnosed for mental health issues, for diagnoses being delayed. So for example, with autism, even though we've seen a lot of improvement in that area with diagnosing Black children, we still see a gap. So on average, parents are waiting 3 years after they initially express concerns about autism. And as someone alluded to earlier, getting those early skills is very important. Having early treatment is very important. So when parents start to see those symptoms and start to have concerns, your pediatrician or whatever provider tells you, no, it's fine, don't worry about it. Just say, okay, it's fine, but let's just take a look just in case. So trust your intuition is the biggest recommendation that I would have for parents.
And there are some, and as pediatricians, there are some baseline screeners that, that your pediatrician or your family medicine doctor should be doing, there's pediatric, they're called PSCs, pediatric symptomatic checklists. There's things called MChats that should be happening early on, even as early as 3 to 6 month visits. So that are happening early on. They should be doing these developmental milestone checks. And so, but if you still are having concerns, then, even 3 to 4 years old, what you're saying is you can be saying, hey, I still have a concern that we're missing something. Then I may need to go talk to a neuropsychologist. And then also, if maybe you have a diagnosis of something like maybe epilepsy or even asthma, then we might have to do those other more extensive tests and come see you as well, correct?
Yeah, absolutely.
And I
And
think
there's
some,
different avenues for that. It doesn't always have to be a neuropsychologist. I know someone talked about how we're short-staffed. So for my office, the wait is 18 to 24 months to
okay,
get in for a routine evaluation. But like, for example, autism evaluations, for people that have Medicaid insurance, they can get that through their local community mental health. There might be other hospitals that do testing as well that have a shorter wait. If there's educational concerns, a lot of schools can do academic testing as well. So there's a lot of different ways to get in where you're not waiting for a full neuropsychological evaluation just to get in for services.
all right, okay. So this is gonna be my question to the panel, as well, and then we'll take any questions. I don't know if there's gonna be any questions in the chat as we're kind of, getting, leaving about 10 to 15 minutes, but I wanna also, to the panel, in each of your roles, oh, and this is the question I do wanna ask you before we go, before I get to the panel, I'm gonna pause here, I'm taking a little liberty. One of the things I want you to express, what if I need testing for an IEP or for a 504 plan? Can you just tell the audience
So-
what I need to do? Because there's some fallacies of what I need to do. So for our educator, can you just speak to that real quick? What do I need to do? Because I've heard people not know what they truly need to do. So I just tell my patients all they need to do is put it in writing. They can literally put it on a Post-it note.
I was going to say that. Literally, I had a sticky memo from a parent 2 years ago. I would like my child to be evaluated. And that was all. A yellow sticky was what was needed. And from there, what I personally do is email the school psychologist, put my assistant principal on it, and also my SST, which is school student success team. Some people might know it as Child Find, but yes, that is it. But I want everyone to be aware, because it's not just enough me having that knowledge. Everyone who touches the lives of those scholars of ours need to know what has been asked. And so that there's no more gaps, or like Dr. Valisa said, it could be misunderstood, or you have to wait months at a time. And no, and we do follow-ups, making sure, hey, did you see this email? This parent has requested. So that's definitely the misconception, is you got to draw up this long mini dissertation. Absolutely not.
Yes.
Yellow
And
sticky will do.
so that's the other thing. And I also try to advocate for patients who have even like things like seizures or diabetes or anxiety and depression. You can get a 504 plan with help
Absolutely, a
them
medical
for like
accommodation.
all those things. And so parents they're like, I said, that could, a 504 plan, if you have anxiety, it could even help you. Because they said, well, I can't go to school. I was like, a 504 plan, the school will work with you that you can get a little time so you can just go have a time with the library, or stand in the nurse's office or something like that. And a lot of parents don't know. So with that, I'm gonna ask each of you to answer this question. In each of your roles, and I know this is a lofty question, but in each of your roles, how do you see advocacy playing a role? How would you see advocacy if you're giving advice to anybody, or what would you advocacy? Or if you want to give advice to to our audience.
I'll jump in and make
Go
it
ahead.
quick so we have questions. For me personally and professionally, show up. Show up. That's my advice. Ask the right questions. Now, when you show up, make sure your behavior, your mind, and your spirit is right. Because some people show up and they come to the office demanding, I ain't leaving until I speak to somebody. No, 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 no. We want you to show up authentically yourself. However, please show up with the right intentions and not trying to cut up on everybody in that space. And also ask questions and be honest. I don't know, Dr. Edie, but I'm coming to you. This is what my child said, but I want to know, is this right? And parents are believing these elementary kids. And I told a dad this morning, I had to make an executive decision, and we're being recorded. And I'm not going to say what I did, but I advocated and allowed that parent. I said, look, sir, you showed up for your baby. I'm going to give you a sticker badge. I'm taking your license and information down. And when you go on this field trip, make sure you stick to your daughter and your daughter only. But believe 50% of what your daughter says and call the school for the other 50. And he's like, I got it. So that would be my advocate or advocacy space and advice to say to a parent or parents, male, female, mom and mom, dad and dads, show up your authentic self, but show up and ask questions.
Okay. All right. Right.
I
Jay?
will, yes, I will jump in this and say it really is speaking up and getting the support you need for yourself. And if you have the influence or control for those in your life as well, therapy. Therapy. Okay. And it is difficult. It is scary. Feelings are simple, but they are very powerful because they are very fearful for a lot of us to get into an experience. But do it for yourself and for your family to take care of you. Because again, your mental health is affected by and it affects every other aspect of your life. So show up for yourself in that way to take care of yourself. And the other thing is for those that you have influence over to encourage them as well to get support and to maybe not support illness or glamorize mental health illnesses. Unfortunately, we do see that. So I'm if we're gonna call out things, let's get treatment for it, is where I'm going with it. So taking care of yourself, showing up for yourself, and also encouraging others to do the same. Because the work that I do really is contingent on people getting to a point where they're like, okay, I'm ready to do something about how I'm feeling. I want to feel better. Notice that you want to feel better. And guess what? I believe you can. And even if you don't think you can, I believe enough for you until you can. So just show up for yourself to at least try.
All right. I love it. All right. Lisa.
I would say leading with a collaboration mindset. So a lot of the families that I see, they're having to navigate multiple different systems, the medical system, educational system, family systems. And I think with navigating all those things, it's important to know that most people have the best intentions. So it makes it harder to advocate for yourself, to collaborate if you're assuming the worst in people. So I try to encourage my families to do that, even though they're frustrated with all of the barriers that they face, just to keep in mind that majority of people have the best intentions, whether it's the principals at the schools or the teachers or the counselors, the therapists, they all have the same goal of helping children.
I like it. So show up, collaborative. I love it. So thank you. Thank you to the panelists. And I do think, thank you for the panelists. I don't know if there's any questions in the chat. Please feel free to put some questions if you have any questions for this. As you all were talking, I did some quick math. We have over 60 years of experience on this panel. Some great depth of, and please take care of yourselves. There's no questions right now. And it's okay to not be okay, but it's not okay to stay that way. I'm a huge advocate of therapy. And if you go to therapy, you can go back to therapy. It's amazing. We take our cars in, get our oils changed, get our oil change, do all these things. We go get our hair done, getting it tightened up, but we don't go in and check ourselves then. So, go back. If you feel something not quite right, go back. You said, well, I went to therapy, go back. If you and a therapist don't click, one of the adages, one of my former social workers used to say, she said, therapists are like the boxes of chocolate. And this is not a Forrest Gump analogy. She said, you open the box of chocolate and you look at them and they all kind of look good, but you might like the one that has caramel. Some of them like the one that have the nuts in it. Some of them like white chocolate. Some of them like dark chocolate. Somebody even likes that one that has the cherry with the gushy center. But that doesn't mean that they're not good therapists. It just means it's not the right one for you. So please go back, and please, we have to continue to deal with the traumas that we've had in our old and young lives. I think it's so important. And I think I agree. Continue to ask questions, and there's a lot of community resources. There's a ton of community resources out there. Well, still don't see any questions in the chat. I know we have a few more minutes. Any thoughts, any last guiding words from our panel? Anything that sparked any last words?
I just want to add, because I'm quite sure there are multiple parents on this Zoom call, but just understand, our children, our nieces and nephews, our family, we are our people's first teachers, whether they're children, whether they're siblings, they're watching us and being influenced. So make sure that you are doing what is right and you are modeling what it is the expectation is with mental health or therapy. And because I always say self-care is healthcare. It is mental health, taking care of yourself. And it's definitely multifaceted, but take care of yourself and model that positive behavior. And like Janae already said, get some help. Therapy. Yes, why not? And you made an excellent point, Dr. Lisa, when you said, get our oil changed. We make sure we get them tires shining nice and bright. Okay, hair retwisted. So yes.
Yes,
Take
all
care.
of the things.
All.
And I know we didn't go down, as a physician, sometimes we talk about medicines, we don't talk about medicine. I know there's therapy, therapy and medicines, people do have concerns about medicines. I know there are a lot of people who say, I'm really concerned about the side effects of medicines. I am not a big med. I always say I'm not a big med to the left, med to the right person. There are side effects of medicines. I will tell you, one of the most dangerous medicines we have is sitting in our cabinet and no one thinks twice about it. And it's called Tylenol. And so that is one of the most dangerous medicines. And people don't think twice about it, but it is a very dangerous medicine because it's very lethal at the wrong doses. So I always remind people of that. And so please be careful of that. But and a lot of times people get, especially historically, we also have to be mindful that I'm also aware that historically, especially persons of color have been misdiagnosed, especially around schizophrenia and things like that. But I also know that the problem with a lot of our medicines is that people a lot of times don't take them consistently, and medicines have to be titrated, and it's slow. It's a slow process. And so be very mindful that of medicines, communicate your symptoms with your provider. And a lot of times people say, well, I don't want to take medicines because I'm not crazy. Or the other thing I hear is so-and-so took that medicine and that medicine made her crazy. And I will say that could have been a different medicine, a different time, and aunt so-and-so might have had a different diagnosis. And so be very mindful of that. And the other thing is when we talk about medicines, especially around ADHD, I think trial of behavior techniques and possibly medicines may be helpful. Again, if you have a broken leg, you would use a a cast and crutches. But I also say you also use therapy to also strengthen the muscles of that leg. So I am a proponent of multi-modes. And so, I like to hear all people's concerns about medicines, but having a full kind of, 360 discussion about medicines. And so be very mindful of people's concerns. And angst about medicines. Any other thoughts, questions?
I think I just want to say, kind of putting it all together, that really when we're talking about a self-awareness and being able to recognize what I need as an individual. We say go to therapy or medication or whatever the thing is, being able to take a moment, because a lot of us don't. We're going through life doing things and engaging with people and working jobs and going to school. We're doing the things, but not taking the time to learn me and what do I need to thrive. A lot of us, we are in survival mode and have been for generations. And I think with this mental health awakening, it's really going to come down to, okay, I'm awakened to me, but what do I need to thrive? Everything doesn't work for everyone. Like you just said, every medication at that dose isn't going to work the same for you like it may do for me. Every therapy approach, every type, whatever it is, it's not going to be the same. And so I need to take time to sit and whether with a professional, with God, with family, with trusted people, to figure out what works for me so that I can thrive and then actually do those things.
Yes.
So I would just say that self-awareness piece is really key when we're talking about our mental health. So I just want to throw that.
Yeah, and I agree. And I always say that 3 of the cheapest drugs I have are water, movement, and sleep. Water, movement, and sleep. They are the cheapest, the freest, and they tend to work. One of the best things, one of the worst things, we do not get enough sleep. That's a whole other thing, right? Melissa, we don't sleep, right?
Now, that's one thing I do. I'm serious. I'm serious about I'm serious about getting in that bed 8:30, 9 o'clock. I keep looking down. I'm like, oh,
You about to go to sleep now, right now. 8:05. You gonna get off this webinar, go to sleep. She was like, y'all keep me from my nap right now.
Yeah. And I would add deep breathing. It's also, please breathe. Like breathe. We don't.
No.
That's about it.
Felisa, any words from our resident neuropsychologist? Anything?
I think I liked your comment about using a multimodal approach to address issues. And I would say having the same type of perspective with leaning into a lot of different people that are involved in a child's care. So leaning into what the teachers are doing that's effective at the school, or what your pastor's doing, or the Sunday school teacher is doing that's helpful with your child, but not just depending on what you're observing at home.
Well, I think we're at the top of the hour. I want to thank my panelists. I want to thank you all for your time. Please take good care of yourself, and I will turn it over to our first vice president. Thank you.
My, oh my, oh my. I don't even know what to say. Just so many nuggets that I took away from this session and I'm gonna read some of them. Take time to identify the signs. We still have barriers to address, such as insurance or the lack thereof. Take advantage of employee assistance programs. Representation matters. It's important to manage emotions, understand the importance of communication. Don't steer away from problem solving. Life is lifing for everyone. You are not alone. Suicide is a critical concern. Mental health doesn't have a color. It can come upon anyone. Everybody needs a therapist. Get one. There's developmental differences between youth and adults. Let the brain rest. Sticky notes are your friend. Keep it simple. It doesn't have to be a dissertation. Advocacy is important. Mental health impacts everything in your life. Don't glamorize mental illness. As a parent, trust your intuition. Disparity still exists. Self-awareness is important. There are free resources: water, movement, and sleep. Who said that? It's okay to not be okay, but it's not okay to stay that way. That was powerful. I bolded that. And the last thing was actually dropped in our chat. So if you are in a crisis or experiencing a life-threatening situation, please call 988 or go to the nearest emergency room. So as we close out, I know there's some people who have been on this call who didn't have questions, but they're shared and they're also involved in this work, and they were guests and attendants on this presentation, this webinar tonight. So we just thank you for joining in, and we thank you for the work that you do. And we ask that you continue to serve our community and serve yourself. With that being said, there's also a form that you want, if you want, you can take time. We would love to hear your feedback as we continue to bring about additional resources to the community to support our youth, to support other sisters, as well as support the Black community, hence all communities. Thank you all for joining us, and have a wonderful evening.